A silent threat. 12 signs that could indicate melanoma. Melanoma, medically known as malignant melanoma, is a serious form of skin cancer that originates in the pigment-producing melanocytes in the lower part of the epidermis. It can develop in existing moles or appear as new dark spots on the skin. Melanoma is known for its ability to spread to other parts of the body and can become life-threatening if not detected and treated early. The primary cause of melanoma is damage to skin cells, most often caused by ultraviolet (UV) radiation from the sun or tanning beds. This damage can lead to mutations in the DNA of skin cells, causing them to grow uncontrollably and form malignant tumors. While melanoma can occur in anyone, individuals with fair skin, a history of sunburns, numerous moles, or a family history of skin cancer are at higher risk. Melanoma is often curable when detected in its early stages, making awareness of its signs crucial. The ABCDE rule is a helpful guide to recognizing the typical characteristics of melanoma: asymmetry, border irregularity, color variation, diameter greater than 6 mm, and evolution or change over time. However, not all melanomas fit these criteria, so it's important to notice any new or unusual spots on the skin. In the United States, melanoma is the 5th most common type of cancer, with rates steadily increasing over the past few decades. Approximately 100,000 new cases of melanoma are diagnosed each year, and it accounts for a large percentage of skin cancer deaths. To address this crucial health issue, I will outline the top 12 signs of melanoma in today's video, empowering you to recognize and take action against this silent threat. First, asymmetry in moles or skin lesions is a key indicator of melanoma. If you draw a line through the middle of the lesion and the two halves do not match, it's a sign of asymmetry. Normal moles or benign lesions are usually symmetrical, so any asymmetry should prompt a closer examination by a healthcare professional. This asymmetry can be in terms of color, thickness, or shape, and it's often one of the first changes noticed in a developing melanoma. Second, irregular borders on moles or skin lesions can signify melanoma. Benign moles typically have smooth, even borders, while malignant melanomas often have uneven, scalloped, or notched edges. These irregularities can be subtle, so it's important to pay close attention to the edges of any spot on your skin. Regular monitoring for changes in the border of a mole is crucial, as melanomas often evolve in their outline over time. Third, color variation within a mole or skin lesion is another warning sign. Healthy moles usually have a single shade of brown, while melanomas may contain different shades of brown, tan, black, and sometimes red, white, or blue. This multicolored appearance is a strong indication to seek medical evaluation. Heterogeneity in color distribution is a key differentiator of melanoma from benign moles. Fourth, a diameter greater than 6 mm, about the size of a pencil eraser, is a characteristic of melanoma. While melanomas can be smaller when they first appear, most grow larger over time. Any mole or skin lesion larger than 6 mm deserves attention, particularly if it's growing or changing. A rapid increase in size is especially concerning and warrants a medical checkup. Fifth, evolution or change over time in a mole or skin lesion is a crucial sign. Any change in size, shape, color, elevation, or another trait, or any new symptoms such as bleeding, itching, or crusting, points to a possible melanoma. Regular monitoring of skin lesions and moles for changes is vital, as melanomas can develop and evolve rapidly. Sixth, the appearance of a new mole or skin lesion, especially in adults, can be a sign of melanoma. While it's normal to develop new moles in childhood and adolescence, the appearance of new moles in adulthood should be monitored and potentially evaluated by a healthcare professional. New growths on the skin, particularly those that look different from your other moles, are a common sign of melanoma. 7th, sores that do not heal could indicate melanoma or other skin cancers. If you notice a sore or a lesion that doesn't heal, continues to bleed, or repeatedly scabs over and then reopens, it should be checked by a doctor. Persistent sores on the skin, especially when accompanied by changes in a mole, can be a red flag for malignant changes. 8th, itchiness or pain in a mole or skin lesion can be a warning sign. While benign moles are typically not painful or itchy, melanomas can cause a change in sensation, leading to discomfort or sensitivity in the affected area. This symptom should not be ignored, especially if it persists or worsens over time. 9th, redness or swelling beyond the border of a mole or lesion can be indicative of melanoma. This could show the cancer is affecting nearby tissues and causing an inflammatory response. The spread of redness or swelling can indicate that the melanoma is growing and potentially invading surrounding tissues. 10th, change in texture, such as scaliness, flakiness, or a hard, lumpy feeling, can be a sign of melanoma. These changes can indicate that the lesion is evolving and possibly becoming more dangerous. A mole that becomes hard or develops a rough surface is a warning sign that should be evaluated. 11th, sensitivity, such as tenderness when touched, can be a symptom of melanoma. While benign moles are usually not sensitive, a mole that becomes painful or tender to the touch should be evaluated. Increased sensitivity can be due to the rapid growth of abnormal cells within the mole. 12th, bleeding or oozing from a mole or skin lesion is a serious warning sign. Any mole that bleeds without apparent cause or fails to stop bleeding should be checked by a healthcare professional promptly. This symptom can be particularly concerning if combined with other changes in the mole, such as alterations in color or shape. If you have noticed any of these signs or changes in your skin, it is crucial to seek medical attention promptly. Early detection and treatment of melanoma can dramatically increase the chances of successful management and cure. When visiting a healthcare professional, they will likely perform a thorough skin examination and may use a dermatoscope, a special magnifying tool, to get a closer look at the suspicious lesions. In cases where melanoma is suspected, a biopsy is typically performed. This involves removing a portion or all of the suspicious lesion and examining it under a microscope to check for cancer cells. The biopsy not only confirms the diagnosis but also helps determine the stage and depth of the melanoma, which are critical factors in deciding the treatment approach. Melanoma is relatively common in the United States, with an estimated incidence rate that has been steadily increasing over the past few decades. Public awareness campaigns have been instrumental in educating people about the risks of UV exposure and the importance of regular skin checks. Treatment for melanoma depends on its stage and may include surgery, immunotherapy, targeted therapy, chemotherapy, or radiation therapy. For early-stage melanomas, surgical removal is often curative. However, more advanced melanomas may require a combination of treatments. To further protect against melanoma, let's delve into 8 lifestyle modifications that can reduce your risk and aid in the prevention of this serious skin cancer. These modifications include sun protection strategies, dietary changes, and regular skin examinations, among others. Each small change can contribute significantly to reducing your risk of developing melanoma and maintaining healthy skin. Consistent use of sunscreen with a high SPF is a crucial step in preventing melanoma. Apply a broad-spectrum sunscreen with at least SPF 30 to all exposed skin, even on cloudy days and during winter months. Reapply every 2 hours, or more frequently if swimming or sweating. This habit not only helps prevent sunburn but also reduces cumulative UV damage that can lead to melanoma. Wearing protective clothing, such as long-sleeved shirts, wide-brimmed hats, and UV-blocking sunglasses, is an effective way to shield your skin from harmful UV rays. Choose tightly woven fabrics for better protection and consider clothing with built-in UV protection for added safety, especially if you spend extended periods outdoors. Seeking shade, particularly during the sun's peak hours between 10 a.m. and 4 p.m., can significantly reduce your exposure to UV radiation. When outdoors, opt for shaded areas under trees, umbrellas, or canopies. Remember that UV rays can reflect off surfaces like water, sand, and concrete, so shade is important even near reflective environments. Avoiding tanning beds and artificial tanning devices is vital in melanoma prevention. These devices emit UV rays that can damage your skin and increase your risk of melanoma. Embrace your natural skin tone or opt for safer alternatives like self-tanning lotions or sprays that do not expose your skin to UV radiation. Regular self-examinations of your skin can help detect melanoma early. Once a month, check your skin from head to toe, including hard-to-see areas like your back and scalp. Look for new moles, changes in existing moles, or any other skin changes, and consult a healthcare professional if you notice anything suspicious. Professional skin exams by a dermatologist should be a part of your routine healthcare, especially if you have a high risk of melanoma. A dermatologist can perform a thorough skin examination and identify any suspicious lesions that may warrant further investigation. These exams are particularly important for individuals with a family history of skin cancer or those with numerous or atypical moles. Incorporating a diet rich in antioxidants can support skin health and potentially reduce the risk of melanoma. Foods high in vitamins C and E, selenium, and beta-carotene, such as fruits, vegetables, nuts, and seeds, can help protect your skin from UV damage. Additionally, staying hydrated by drinking plenty of water can keep your skin healthy. Staying informed about melanoma and UV protection is essential. Keep up to date with the latest information on skin cancer prevention, including new research, sunscreen products, and protective measures. Educate yourself and your family about the importance of sun safety and the early signs of melanoma, and share this knowledge with your community to raise awareness. Implementing these lifestyle modifications can significantly contribute to reducing your risk of developing melanoma. These preventative measures, combined with regular medical checkups, form a comprehensive approach to protecting your skin and overall health. Remember, each step you take towards sun protection and skincare can make a substantial difference in your long-term health and well-being. In conclusion, melanoma is a serious but often preventable form of skin cancer. Awareness of the risk factors and early signs of melanoma is crucial for timely detection and treatment. Ignoring these signs can lead to the cancer spreading to other parts of the body, making treatment more difficult and reducing the chances of a successful outcome. Moreover, melanoma can recur, so ongoing vigilance and regular skin checks are essential even after successful treatment. The overlap of melanoma symptoms with benign skin conditions underscores the importance of professional evaluation. A mole that changes over time or a new skin lesion should always be assessed by a healthcare professional, as early-stage melanoma can closely resemble a normal mole or benign skin lesion. Advancements in medical science have significantly improved melanoma treatment and prognosis. Techniques like Mohs surgery, immunotherapy, and targeted therapy have enhanced the effectiveness of treatment, especially when the cancer is caught early. These treatments focus not only on removing or killing cancer cells but also on preserving as much healthy tissue as possible and boosting the body's immune response against cancer cells. Historically, melanoma treatment options were limited, and the prognosis for advanced stages was poor. Today, the combination of early detection, advanced surgical techniques, and innovative therapies has dramatically improved survival rates for melanoma patients. In addition to medical treatment, lifestyle changes play a crucial role in melanoma prevention. Avoiding excessive sun exposure, using sunscreen, wearing protective clothing, and conducting regular skin checks are simple yet effective strategies to reduce the risk of melanoma. Education and awareness about melanoma are key to prevention and early detection. Understanding the risks associated with UV exposure, recognizing the early signs of skin changes, and taking proactive steps to protect your skin can significantly reduce the incidence of this potentially deadly disease. Remember, knowledge and vigilance are your best defenses against melanoma. Regular skin examinations, both self-conducted and by healthcare professionals, along with a commitment to sun safety, can greatly enhance your ability to detect melanoma in its early stages and increase your chances of successful treatment. To learn more about this topic, please like the video and subscribe to my channel. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.